this is really my first talk as a president of the European Society of Cardiology. The background for the beautiful trial is that coronary artery disease patients have a high rate of events despite the modern therapy. And coronary artery disease patients with left ventricular dysfunction have even more events. That has been made clear by the CAS registry on 25,000 patients. And you can see the survival is worse as the ejection fraction declines. In addition, we know that in coronary artery disease patients, with or without hypertension, elevated resting heart rate is associated with a high rate of cardiovascular events. This, again, has been shown by the CAS registry, and you have already seen these slides from Professor Tardif. And what the slide tells us is that heart rate equal or above 77 beats per minute is associated with more cardiovascular events. Equally, the data from the INVEST study on 22,000 patients with coronary artery disease and hypertension has shown that when a heart rate approaches the level of 70, there is an incremental increase with worse outcome. So the rationale for the beautiful study was that pure heart rate reduction might reduce cardiovascular events. And this hypothesis has never been tested before, as the beta blockers and the calcium channel blockers, which some of them reduce heart rate, have cardiovascular effects other than pure heart rate reduction. Yes. Therefore, the opportunity came about with ivabradine, which is the first and the only pure heart rate reducing agent. Ivabradine, it inhibits the IF current. And as you just heard, it has a proven anti-anginal and anti-ischemic efficacy, whatever the background therapy. Let me say that ivabradine is a very innovative drug. First of all, because it has a selectivity in terms of anatomy where it acts. Mainly, ivabradine acts only on a branch of cell located here in the right atrium and in the sinus node. But not only it is selective for the sinus node, it is also selected in the sinus node for the so-called IF channels. And the IF channels are responsible for the diastolic phase of the action potential of the sinus node. What ivabradine does reduces the activity of the IF channels, therefore prolong the diastolic phase of the sinus node, and therefore reduces heart rate. Now, it is all very simple for me to say this, having these slides. But I'd like to have your cooperation now, because here in the room, there is the very person who did make this slide possible and who did make all what we are going to say possible. And this person is Professor Dario Di Francesco. Please stand up, Dario, and we need to applaud to him. Thank you for this, because, again, too often in the clinic, we clinicians tends to forget where the merit goes. Ivabradine, therefore, has unique pharmacological properties.